at that word. Good afternoon, Commissioners, County Administration, and Franklin County residents. I am Shonda Wingo, Interim Director for the Franklin County Office on Aging. The mission of our agency is to provide access to the tools and resources that allow Franklin County residents 60 years of age or older to maintain independence in their home safely and securely. Seniors want to age in place by remaining in their homes for as long as possible. Per the 2021 Central Ohio Regional Assessment Survey, 94% of older Franklin County residents reported that this, in fact, is very important or somewhat important to them. Our mission and vision strongly support this desire, as independence must also include quality of life. By using targeted universalistic strategies to address barriers and policy changes, our 2023 estimated revenue of approximately $53.6 million will provide the Office on Aging sufficient resources to support healthy outcomes through new service delivery of home and community-based programs that address the social determinants of health and the goals outlined in the Franklin County Rise Together Blueprint. Those goals include, but are not limited to, stabilizing housing, improving overall well-being, and encouraging long-term success. In addition, we will be taking into consideration the feedback we collected from the Helping Our Residents and Families with Purposeful Engagement, also known as our HOPE campaign. In addition, more data from the 2021 Regional Assessment Survey on Aging and lived experiences from our residents in order to better address the needs of the senior population of Franklin County so that they may maintain their well-being and experience healthy outcomes. At this time, I will turn it over to our Chief Financial Officer, Larice Cohens, to discuss the numbers that make up our recommended budget.
Thank you, Shonda. Good afternoon, Commissioners and County Administration. My name is Larice Cohens, Chief Financial Officer for the Franklin County Office on Aging. Our agency's 2023 proposed budget expenditures are approximately $49.6 million. This recommended budget includes roughly $9.1 million in personnel services and fringe benefits to support our agency staff. Our staffing level target for 2023 is 109 full-time equivalents, or FTEs. The 6 FTE increase is due to a request to add a Deputy Director of Communications, 2 administrative officers, a management analyst, and 2 case managers to assist in implementing 4 planned pilots in 2023. Our recommended budget also allocates $2.4 million for materials, supplies, services, and capital outlay, as well as $3.8 million for grants to provide specialized services to older adults so they can optimize their ability to live and function in the community. We're realigning how we award grant agencies to ensure they fund projects that result in healthy outcomes, such as access to quality medical care, health care, housing, and nutrition, which touches one or more domains in the social determinants of health. The biggest portion of our recommended budget is $34.2 million, which is reserved for social services to directly assist our senior population and their caregivers. This includes services such as transportation, free home delivered meals, emergency response systems, and minor home repair, along with community support, outreach and specialized services, case management, public information, safe housing, and protective interventions. In 2023, we will begin implementing 4 planned pilots that the community has shared are of interest to them. The first pilot will be placing 2 case managers on site at emergency rooms to work with hospitals to connect with those seniors who are deemed high risk for readmission. According to the 2022 Franklin County Health Map, over 50% of hospitalizations due to injury are because of falls, the rates of which have increased for adults over 65 and over since the previous health map. These case managers will provide a focus to those adults by identifying and connecting them to services that can address these issues. The second pilot is a grocery delivery service. During our HOPE campaign, 48% of residents we surveyed expressed an interest in grocery delivery services, all of whom reside in food desert zip codes. By piloting a grocery delivery service, we will be addressing 2 pillars of the social determinants of health: economic stability, food security, and neighborhood and built environment, the availability of healthy foods. Our other two pilots are yard maintenance and specialized transportation services, which have also been identified as desired services by older adults in our community. These pilots will help us to determine if these services are beneficial and should be offered permanently through our agency. We're also looking at the continuation of providing free home delivered meals. And while the impact of COVID-19 pandemic is now more manageable, many older adults cannot afford the increased price of groceries or meals due to their fixed incomes, as well as the impact of inflation. According to the Labor Department, grocery prices rose 13% over the last year, outpacing the annual 8.2% inflation rate for all consumer products. Lastly, we're looking at how our agency can expand data analytics and innovation efforts as we prepare for a new case management system. We'll leverage this data and aggregate the information collected to identify ways to increase efficiency, evolve business models, and expand programs to better serve our seniors. At this time, I would like to turn it over to our Assistant Director of Support Services, Caroline Rankin, to highlight our agency collaborations. Director Rankin, I turn it over to you.
Thank you, Larice. Good afternoon, Commissioners. My name is Caroline Rankin, Assistant Director of Support Services for the Franklin County Office on Aging. In 2022, our agency continued collaborations with several Franklin County agencies, as well as establishing new ones. We continued our partnerships with Franklin County Public Health as part of the HealthWorks Franklin County to outline the new Community Health Improvement Plan and to create an equitable, bold, and evidence-based plan that builds on existing resources and strategies to ensure maximum impact. We collaborated with Equitas Health to bring the COVID-19 vaccine to our homebound residents and their families, many of which are living in multi-generational households or are dependent upon family caregivers. A total of 44 homebound adults received vaccinations over a 2-day period in zip codes that had the lowest vaccination rates. As an agency, we will continue to move forward with efforts of providing both COVID vaccination and the flu vaccine to our most vulnerable citizens. Our agency continues to move forward with the human-centric approach in service delivery by working alongside the Franklin County Board of Commissioners, Health and Human Services agencies to develop a one-door holistic approach in developing support services to residents in need. Our collective impact will be demonstrated through new and existing initiatives such as the mobile and housing units. Additionally, we're working on an agreement with Franklin County Children's Services in which they will provide up to $300,000 in funding to support 200 kinship youth and families served through our agency. This funding will provide up to $1,500 for services for items such as clothing, food, appliances, rent, and utility assistance, and other tangible items. Our agency funding can only support older adults, and this partnership with Children's Services is crucial as it allows us to provide direct support to those children of kinship families. The number of kinship families is growing and will continue to grow. We know firsthand because we've seen an increase of 83% over the past year, serving 55 families in 2021 to 101 families as of November 1st, 2022. This collaboration supports goal number 12 of the Rise Together Blueprint. We've collaborated with Franklin County Department of Job and Family Services and the Franklin County Data Center for an initiative to refine and publish Power BI dashboards amongst the HHS agencies for better visibility, accessibility, and data sharing between agencies. In the last 2 years, our agency has continuously been working to improve collaborations with Franklin County Probate Court, especially when it comes to guardianship cases. Our Adult Protective Services Department has worked closely with the court to ensure they have the documentation needed to make informed decisions regarding the case and the future of the older adult. During last year's budget hearing, we identified financial exploitation as a challenge in 2022. This year, our agency collaborated with the Ohio Department of Aging and the Franklin County Prosecutor's Office to apply for the American Rescue Plan Act Community Violence Reduction Grant to address elder abuse. If funded, Franklin County will pilot an elder abuse prevention and protection forensic center that will provide services and training to better address the needs of our area's aging population and to better protect our older residents from elder abuse. We also launched in October our Senior Seminar Series, a monthly series that allows us to reach residents virtually on topics that are important to them. Our first series focused on financial exploitation and helping older residents and their families know what they can do to protect themselves, as well as the steps they can take if they become a victim. Our agency is working with Franklin County Board of Developmental Disabilities to support the older residents who are caring for an adult child with developmental disabilities. This program equips families with the tools needed to create a roadmap for that family's future goals and desires. We've worked with the Adam H. Board Multi-System Adult Advisory Committee, which serves residents who are involved in other adult-serving systems with wraparound services and funding for housing. This involvement has led to an increase in referrals for our agency, especially for those older adults who are involved in the mental health and addiction services. Another collaboration we have is with the Veterans Services Commission. In providing home repair services and access to community response systems for veterans and their eligible dependents at no cost. This partnership has allowed us to connect our veterans and caregivers to additional available services and resources available through our agency. Lastly, I am excited to share that this past year, we have been working with JFS to launch a new pilot similar to theirs with the Ohio State University Wexner Medical Center. This pilot allows our agency to place 2 full-time community case managers in OSU's East Hospital Emergency Department in order to provide better care coordination, better inpatient and outpatient services, improve access to programs for vulnerable citizens, to vulnerable seniors with medical needs, and coordinate care for the adult after the emergency department visit or hospitalization. Thank you. And at this time, I will turn back over to Director Wingo.
Thank you, Caroline. I'd like to now highlight some of our accomplishments for 2022. Our Senior Options Program includes a cost share element determined by a sliding fee scale. Our sliding fee scale was last updated in 2009 and had remained unchanged for 12 years. However, just this past June, we aligned our sliding fee scale with the 2022 Home and Community-Based Services Waiver Special Income Level. This adjustment allowed residents who are 150% below the federal poverty level with an income less than $1,640 per month and less than $7,500 in liquid assets to receive services at no cost. Adjusting the sliding fee scale allows us to further support the Rise Together Poverty Blueprint by addressing poverty and finding ways to help older residents remain in their homes and allowing them to continue adding value to our community. Although this adjustment to the sliding fee scale has decreased annual revenue for our agency, we are happy to report that this policy change has allowed more seniors to have access to services with lower copays for these services. Our agency has also made significant strides by increasing and expanding our community outreach and awareness, a need that was identified per the 2021 Central Ohio Older Needs Assessment. To address this challenge, we added our 2 new positions for our communications department, a deputy director and a public information officer 2. Both were hired in May of this year. The addition of these positions created an immediate impact with our agency's overall reach. Here at FCOA, we define reach as the potential number of people that our messaging could touch. Throughout this year, we began tracking our reach from social media, sponsorships, advertising, PR campaigns, and our community outreach. I am pleased to report that these efforts have garnered our agency quite a significant reach for 2022, with a reach of over 2 million. Examples of these intentional efforts include the expansion and frequency of our social media presence, our Hope campaign, which aired on 10 TV, and the Caregiver campaign radio ads that aired on Urban One radio stations. This communication strategy allowed us to be intentional in bringing awareness to the services we offer Franklin County residents. Our participation in outreach events is also a notable area of success, as our small but mighty outreach team has taken our agency to new heights. Participating in 29 community events in 2021 to surpassing over 300 events in 2022 and directly engaging with almost 15,000 residents. These events include everything from facilitating agency overviews, job opportunity fairs, community resource fairs, and sponsorship of major events like the 3rd annual Caring for the Caregiver Expo. According to the 2022 survey by AARP, 53 Americans are now served as unpaid caregivers for adult family members or their friends. Sponsoring the Caregiver Expo allowed our agency to be known as a leader in the caregiver space and show gratitude for the tireless work unpaid caregivers deliver. Additionally, we used a human-centric approach in collaboration with the other HHS agencies for the Lunch and Learn sessions and on topics such as Medicaid, Medicare, the long-term care process, kinship and caregiver services, as well as mental health support. Our agency is also excited to announce that our agency has served over 76,000 residents in 2022, directly through our FCOA programs and our grant programs, resulting in surpassing many of our 2022 key performance indicators. By the end of third quarter, our accomplishments include serving more than 11,000 seniors through the Senior Options Program, completing over 2,000 minor home repairs, and serving more than 50,000 seniors through our grant partnerships. I'd like to note that 2 of our grant partners, the Community Refugee Immigrant Services, also known as CRIS, and the Asian American Community Services, help us reach seniors by providing case management and linkage to resources for our refugee and immigrant populations. As an example of this, through CRIS, our older refugee and immigrant program, which will assure that refugees age 60 and older living in Franklin County receive services that will help them remain independent on their journey toward becoming U.S. citizens and have full access to those resources and opportunities of the mainstream. Another accomplishment I'd like to highlight was during a time when our residents needed us the most. On June 14th and 15th of 2022, Central Ohio was hit with an extreme heat wave, resulting in forced power outages, impacting more than 169 residents in the Columbus area. Once we received the news of the widespread power outage, our agency, in collaboration with our sister HHS agencies and various community partners, took immediate action and began checking in on our most vulnerable older adults. During that time, we were able to complete over 150 wellness checks, more than 7,000 phone calls, and we distributed over 700 box fans and 10,000 bottles of water to our seniors. The final accomplishment I would like to note is the passing of the Senior Services Levy. We are more than excited as 2022 marks the end of our current levy cycle, and it also recognizes our 30th year since the first Senior Service Levy passed in November of 1992. The passing of this levy is critical because it allows us to continue providing services that help Franklin County seniors age in place. Services such as home delivered meals, adult daycare, and transportation, and more. I am more than thrilled to announce that just last week, our levy passed with a 78% vote. I would like to take this time to personally say thank you to the residents of Franklin County for supporting our Franklin County seniors. While we are proud of the accomplishments we've made in 2022, we know that there are challenges that remain ahead in 2023. Since the onset of the pandemic, the nation has faced a major disruption to the labor force, which many have referred to as the Great Resignation. According to the U.S. Chamber of Commerce, and more than 47 million workers quit their jobs in 2021. Like many others in the U.S., our agency is seeing the impact of the Great Resignation through a shortage in workers through our contracted partners. In 2022, we had 99 active providers. 14 of them closed their businesses or discontinued services, ultimately impacting service delivery to more than 456 residents who reside in the zip codes 43207, 43232, 43229, 43213, and 43223. As a result, our agency programs such as home health care and adult day services have longer wait periods for service. To combat this moving forward, we have begun improving our communication strategies to appeal to a wider range of community providers during the bidding process, and are in the planning stages of aligning our grant funding and projects to ensure that grant services support the social determinants of health in the Franklin County Rise Together Blueprint. Another challenge we face is the continuing impact of the COVID-19 pandemic and widening disparities. This is particularly true for digital equity, as the use of online tools and technology can only be utilized by individuals in the communities who have the real resources available to do so. During the pandemic, we funded grant projects that piloted programs specifically for older adults and creating digital equity. This year, we've continued to be part of the Franklin County Digital Equity Coalition, which focuses on affordability and access to technology, as well as teaching digital technical skills and technical support. In 2023, we plan to continue our efforts to address digital equity among older adults by supporting community-based agencies that provide education, resources, and technical support to the older population and inclusive of those with impairments. The COVID-19 pandemic exacerbated social isolation and loneliness among older adults, which is especially concerning for our older adults with chronic conditions and functional limitations. According to the Center for Disease Control and Prevention, recent studies show that social isolation significantly increased a person's risk of premature death from all causes. Loneliness was also associated with higher rates of depression, anxiety, and suicide. Our agency is part of the Franklin County Suicide Prevention Coalition, which connects us to resources available for suicide prevention, intervention, crisis, and post-intervention. We will ensure that our staff have the training needed to spot risk factors and can identify immediate resources to link older adults to mental health support, including the county's own free mental health tool, Credible Minds. We are also helping seniors combat loneliness and feel a sense of connectedness through our Engaging with Aging initiative. Our intentional outreach for our seniors and their families, such as sending them thank you cards, holiday cards, and birthday cards. To date, we've mailed over 4,000 birthday cards, and we know firsthand how this simple act has touched their lives through positive feedback we received from this gesture. Some additional things that we've done through Engaging with Aging is sending a monthly newsletter to over 3,000 residents on a monthly basis, as well as hosting our senior seminars series. Lastly, I want to mention affordable housing, as it continues to be an issue that older adults face. Affordable and accessible housing is in short supply for seniors, and residents are cost burden, spending on average more than half of their total income on housing costs. According to the 2019 American Community Survey, among those 65 and older in Franklin County, 23% of owner-occupied households are housing cost burden, and 57% of renter-occupied households in this age group are cost burden. As a result, older adults are likely to sacrifice other necessities such as food, medication, in the attempt to meet the demand of their housing expenses. This sacrifice often leads to more seniors needing emergency medical care as the result of malnutrition or lack of proper medication. Increasing rent, mortgage costs, and the lack of resources such as savings is forcing older residents who have insufficient or fixed incomes out of their homes when met with an increasing housing expense or unforeseen expenses. To help prevent homelessness, our agency is joining forces with our sister HHS agencies for a housing unit intended to serve our most vulnerable populations of Franklin County. We are also in the early planning stages of working with both the Franklin County Auditor Property Tax Assistance Program, also known as PTAP, and the Franklin County Treasurer's Office STAR program to develop a framework for seniors who have been out-taxed or have delinquent property taxes. We also know that to prevent homelessness, seniors need more disposable income. Thus, we are working with older adults to link them to services at little to no cost. This includes services that we provide, such as free home delivered meals and transportation, as well as linking them to community organizations like the Charitable Pharmacy of Central Ohio for medication. When residents come to us for housing, we have about 10 community organizations that we work with, such as the Community Properties Ohio, who have senior housing locations, and Oasis, who provides housing navigation services. To date, we have been able to connect 88 seniors to those organizations who have helped them locate affordable housing. In conclusion, I am excited about what this agency has accomplished and what the future holds for us as we wrap up our current levy cycle. However, I know that there is still a great deal of work ahead of us. With the passing of the new levy cycle, our agency is eager to continue our work in serving seniors, caregivers, and kinship families of Franklin County. Thank you, commissioners and county administration, for allowing us to share with you today our accomplishments, challenges, and future initiatives. Thank you to the phenomenal team and partners who make the magic of FCOA happen. We are happy to answer any questions you may have about our testimony and the 2023 proposed budget.
Thank you for that. I do have a few questions, and I'll try to be brief, and trying to be mindful of everyone's time since it is 4:03. Thank you for your leadership, Director Wingo, and all that you all are doing, your team is doing in the aging space is truly appreciated. And thank you is just not even enough or sufficient to say. To show appreciation for myself and my colleagues and gratitude for what you all are doing for our aging residents. Ohio in general is an aging state. And so we know that there will be more of our neighbors who will need services in the years to come. So I appreciate all that you are doing. My first question is, do you know is there a direct correlation? I'm assuming that there is, but I hate to assume. So hopefully you have some numbers. Direct correlation on new applications or new neighbors engaging with the Office on Aging, a direct correlation between that and the new outreach team that you hired earlier this year.
Thank you, Commissioner. We're still tracking that data. One thing I didn't note very well is that most of our initiatives began in June. And so some of this data, including the enrollment numbers, really started to uptick around that time. And we're still collecting that data. I would like to assume as well that our outreach efforts do have a direct impact. But I also believe that the barriers that we removed around the sliding fee scale also attributed to enrollment numbers. The sliding fee scale had not been adjusted in 12 years and did not take into account the cost of living increases that happen on an annual basis. And so what we were seeing is seniors were accumulating balances that they couldn't afford and disenrolling from the program. And so by removing those barriers, we've been able to have more seniors enroll because it's more cost effective for them. On the slide that we had that represented that, under the old sliding fee scale, a senior that had multiple services, the copay was around $111. And once we updated that, it took that copayment down to $37, which is more manageable, especially for our cost burdened seniors. We are also in the process of upgrading our systems, which should allow us to have better reporting for 2023, where we will better be able to answer that question, whether or not there's a direct correlation. But at this time, it still remains an assumption.
Thank you. One of my questions, and I'm not saying that we should do this, so please, everybody who's on the call, don't say that I'm advocating for this or against it, but you talked about our residents, our aging, needing more disposable income. And we saw, I think last week, or just a few days ago, where Toledo City Council, at least, so separate from the county, approved $800,000 to wipe out medical debt for specific people. Again, I'm not advocating for that, but as you're surveying our neighbors, do you have an idea of how many residents have medical debt that impacts their ability to keep a roof over their head, water running, and lights on? Or like survey asking, like, what are barriers to thriving?
I'm sorry, Commissioner, I don't have that data, but that is something that we're happy to take a look at, especially as we're preparing to expand our data analytics team in being able to research and pull that data.
Okay. Another question that I have, outside of trying to connect families or caregivers with other organizations, what do we do in the respite care space?
We do a lot. I would not do great service in explaining that, so I would like to be able to have Assistant Director Caroline Rankin speak more to that. But we do know that the face of aging is now multi-generational. It's not how it used to be. You have more and more adult children taking care of their family members, which I'm on a new journey myself, just as of July of this year. But we're also seeing more and more grandparents and great-grandparents taking care of their children. And so I would like to let Caroline go ahead and explain that further.
Oh, Caroline, you're on mute.
Sorry about that. Thank you, Commissioner Crawley. So, as Director Wingo shared, we are seeing more and more caregivers. They come to our agency and they really, they need assistance and they're not really sure what to ask and how to ask it. So respite is a big part of that. They're tired emotionally, physically. And so we work to assist them with respite. It can look in many different forms because one of the challenges we have seen is not having much more demand for respite care with a provider than than we are able to supply. So what we really try to do is help that caregiver with the services that we can. And one of the things that, in addition to a respite caregiver coming in and helping them, we're also linking a lot of our caregivers with caregiver counseling. They need support, they need somebody to talk to. And so we're able to do that for them. In the area for our, with the kinship families, again, it's helping that that kinship caregiver meet the needs that they have for that child. Oftentimes it's immediate needs, and this is not something that they had planned for. So how can we assist them? So respite, that is an area we will continue to look for ways to be creative, because it isn't just meaning that somebody can leave to take a couple of hours off. Sometimes it does, and somebody can come into their home, but other times getting them set up with a counselor, getting them connected with one of our grant agencies that provides a support group, that is a great asset for them, and really providing them with those additional resources outside of our agencies that we may not be directly be able to provide, but knowing that they're going to have that continued support.
Okay. Thank you for that. Two questions on housing. One, do you have any data with our community partners like Impact or the Veteran Service Commission on how many of the residents for 2022 that needed rent and utility assistance were over the age of 60?
Right now. So we have the data, we don't have it in front of us. We can supply it to your office later.
Okay, and then what outreach has been done, if any, follow-up from aging to connect with those residents?
So on that, I'll let Caroline also answer that, because she is the Assistant Director over Supportive Services that leads those initiatives.
Thank you. So again, what's critically important, we are seeing more and more of our residents come to us for housing assistance. We were so grateful in the beginning of the year to have that rental assistance specifically for our older residents. We are working specifically, we work with Impact. We are working with Central Community House, Gladden, St. Stephen's, and Renfrew. And what's critically important is it's not just, when a resident reaches out to us, it's not just saying, okay, this is who you contact. No, we help them step by step. We're making that connection. We're helping them apply online. We're ensuring that they're getting that assistance. But that's just part of it. They're going to get that assistance that may help them. But again, that's not a long-term solution. So what needs to occur and what needs to happen? What we are seeing with our older residents is their income is not rising as everything else is rising so much more rapidly. So we have to assist them with, if they're getting rental assistance from one of those agencies, what is the long-term solution to make sure they're not just back here in several months? And so that's part of our whole plan, is really looking at the wraparound. Rental assistance is just a piece of it, but it's ensuring that those the medications, the transportation, all those other things are going to be affordable for them. So they can stay where they are, because we know that's where our residents want to be, is in their home and in the community.
Absolutely. Absolutely. So a follow-up to that, because I know that Director Wingo mentioned the partnership with the auditor's office and the treasurer's office on taxes, whether they're delinquent or just unable to pay. What type of services are we providing to our residents? And I think we have approved a contract before for legal aid at some point in time, but I'm specifically asking about support when it comes to those who are on Medicaid and Medicare, so they are not having to leverage their house or possibly lose their home at some point in time if they are no longer, like if they have a caregiver and they're aging in place at home, trying to remain independent, but at some point in time might have to go into a facility for care, that that house or what they've worked so hard for to maintain is not lost because of the laws that are surrounding Medicaid and Medicare. Is there any, whether it's literacy around that, support services from legal aid, how are we making sure that residents, if they have a home, they can keep it, even as they continue to age and might need additional services?
So the first part of that, the services that we provide through Senior Options are intended for that purpose. To provide those services so that they're not enrolled into an additional program, such as a Medicaid program that would, look at their assets. So as long as they are eligible for Senior Options, that prevents them from being passed over to a Medicaid program that would cost them their resources. I know that Caroline does work closely with other entities such as legal aid, as well as many of the Medicaid case managers. She'll reach out directly and talk with them and make sure that the residents know that what their choices are and how to make informed decisions. She has specific conversation and training around what are your options to make sure that the community is informed. And so that's where we're at now, but we will continue that work and we will be more intentional because we know, as we mentioned, the caregiver space, as well as, the population of seniors by 2050, there'll be more seniors than there are kindergartners. So we recognize the need to make sure that seniors can protect their assets and that their families also are aware of what their options are in that process.
Thank you. And then my last question is around mental health services. And I know you touched on it. Oh, I'm sorry. Administrator Wilson, did you?
No, finish, President Crowley. I just wanted to, I wanted to have a question I had was so closely associated to what you just asked, but go ahead and finish your line of question.
Oh, okay. Last one that I have is mental health services. And I saw your partners up there, and I know you mentioned the Credible Minds platform. But in particular, our aging males, Black men especially, that have served. There is this notion that folks go to the VA for care, or they know where the VA is, which is true, but they might also be getting mental health services. That is absolutely not true and should not be assumed. And everybody can't access Credible Minds, whether they can do it on a computer or on their phone. That might be a barrier. And I care about mental health services, but also addiction, like alcoholism. And I know we try not to be intrusive, but you know, especially when people are lonely, and you talked about all of that, what additional resources or connections where we're not necessarily hands off, but what else can we be doing in this space to, one, help someone who may, you know, if we just think about that population, they're not going to be like, I have a drinking problem or anything like that. But how do we make sure that when they feel comfortable to share that they need help or don't know without feeling guilt, shamed, you know, and those issues that come with, you know, self-identifying as something.
So the first part, Commissioner Crawley, a part of our case management programs, there is an assessment that's completed with our seniors, and there is direct linkage to mental health services in the event that that's identified as a need. Additionally, Caroline heads up our collaborations and can speak more to the work that she's been doing with Adam H. On the mental health initiative as well as addiction.
Thank you. So, you know, one of the things that we definitely see an increased need, and yes, making sure that they know services are available. For many of our older residents that we work with, there's so much pride, they don't want to take help. And we really need to break down that barrier and make them realize we're here for you. We're here to help you. And these are the services available to you. And so we work to do that. Adam H, we're working very closely with to do the multi-system program, because that is one where they're engaged with multiple systems, and the older adults are a big part of that. And so it really is allowed for older residents who may be already in another system to get linked with us. But during that time with collaboration, we're also able to then, as we are working with more and more residents, and we are doing that case management work, and we are finding out the needs, and they're saying, yes, I want help, we're then able to link them by building those relationships. Also, we do work a lot with the Veteran Services Commission. They are in our building. You know, when we have a veteran, we are working with them, linking with them. And again, we're all part of the team. We're all part of a team to help this older adult to become successful. So at no time is it like, okay, I'm going to give him now, it's Adam H. No, our case managers stay involved, stay engaged, because we're doing that long-term case management in most cases.
Thank you. I appreciate that. Administrator Wilson, I'm done.
Thank you, President Crawley. Going back to housing, again, congratulations on passage of the levy. Everyone involved, our two co-chairs, the former Commissioner Marilyn Brown and President Anna Watson, and the whole entire team, the Board of Commissioners support in having that being overwhelmingly successful. With housing, we have a home improvement program that we've really been wanting to bolster, try to get more providers, create more flexibility. I really want us to make sure that we publicize and create options for our seniors to receive funding, because one of the things I worry about is our seniors that are in need of minor home improvements could sometimes be talked into leveraging their property for the cash to do it. And that could put them in a very vulnerable position, given so many of our seniors have fixed incomes tied to the consumer price index of Social Security, which people are going to get a historical bump this upcoming year. But I also understand that some of our seniors are concerned about their leases going up by that amount because there's a knowledge that of them having this extra money. So one of the things, you know, I and the commissioners have talked about is visibility. We have these resources. We don't want to, there's no reason to suppress our outreach efforts in any way. So the housing space, the money is there in the recommended budget. So I want you all to think in an innovative fashion and vet out some ideas as to how we can be more helpful to our golden residents.
Thank you, Mr. Wilson. We have been having conversations with some of the other community partners that deliver minor home repair services to identify some strategies. So it is something that is on our radar. And we recognize the need to expand those services, but we also recognize that that also starts with our communication strategies around the contract process and the bidding process, and making sure that providers understand the language, and that we are reaching a wider, broader audience when we put that information out. And when that information goes out, it applies and it captures the audience we're trying to capture. On our last contract that we have, there's 19 providers, 9 of them are general contractors, and only 4 of them do ramps. And so we need to make sure that when we are putting this information out and we're considering the bidders and the bids, that we also identify an adequate amount of providers that provide the services that we have the most requests for. Ultimately, when you have 19 providers and only 4 of them do wheelchair ramps, that causes delays and issues and challenges. And so we are very aware of that and have been working with purchasing and the prosecutor's office to update that process to ensure that we can expand that appropriately.
Okay, thank you.
Thank you.
I just want to say before Director Bivens goes, thank you so much for that, Administrator Wilson. I was just talking to someone last week about one of our senior citizens being scammed for home repairs, and they are very vulnerable. So I appreciate that. Thank you, Director Bivens.
I just want to say just really quick, we also, in working with Director Ringo and her team, we identify an opportunity with our Building Futures program to start having conversations with them where if there is a deficit, particularly in this area, maybe there's an opportunity for some of the participants and graduates who have that skill set. So we're going to begin those conversations here soon. And then my last thing, just really quick, since Commissioner Crawley brought up Toledo, erasing in their effort to erase the medical debt, my shameless plug to Franklin County Office on Aging is, as you launch your outward newsletter, we are looking for people to work for in the areas of all areas of Franklin County, particularly for HHS, but I have to be fair for all areas. So can you make sure that those seniors who are retired and maybe caregivers, if it does not impact their income, that they know about our job postings? And can we have an employment section on there? I know some seniors can't work because it impacts their employment. I don't know, Chris Long is going to jump in and try to get her plug in too. So, so can we make sure we let them know this could impact your income? However, for seniors who it will not, and you want to get back into the working field, we have a home for you in Franklin County, particularly HHS.
Yes, we sure can.
Look at Chris Long's face.
All of our agencies are anxious to hire everyone who is out there in the community. So we are all ready and able and welcoming with open arms.
All right, Zach.
All right, thank you, Commissioner, and thanks to the team from Office on Aging. And with that, that concludes our budget hearings for the 2023 recommended budget. We will be planning the Office of Management and Budget to put together the appropriation measure that will be submitted for Commissioner's briefing on Thursday, December 8th, for final approval at general session on Tuesday, December 13th.
I just want to say before people log off, which they're doing already, thank you so much for all the work that you all continue to do for Franklin County, for our residents, on behalf of the Board of Commissioners. It doesn't matter what our priorities are as we listen to the community. Nothing would be accomplished or get done without you all. So even though we might not have heard from your agency, we appreciate all the work that you all are doing. Thank you so much.